Hey everyone, welcome. Welcome to our monthly series of Healthcare AI for Dummies. I am Missy Krasner and I am your host. I'm an operator, a digital health investor, and I've been lucky enough to be in the industry for a long time to meet my very esteemed guest today. Today we're talking about Gen AI startups, and as a startup founder, how do you build a solution and go to market? There's a lot of activity going on today in what we call Gen AI in healthcare. And we've got two veteran operators here to talk about what their solutions are. So let's start with Khan. Give us a little bit of your background. Tell us about what you're up to right now, and we'll dig in.
Awesome. Great to be here, Missy. Thank you for inviting me to talk about this stuff. We go a long ways, by the way. My background is I'm a radiologist, practiced for a decade, was faculty at University of Maryland and at the Johns Hopkins, but my academic work was all focused on computer vision, machine learning. Started pretty earlier on in the 2000s, and based on that work, I got recruited by Microsoft in 2007 to lead their first healthcare AI team. So I did a lot of the early work in computer vision, machine learning there, and the work we did ended up becoming part of Xbox Connect and other things. And that's where you and I first met when I got involved with HealthVault and you were at Google Health at that time. I then left and started a company called Higgy, which was a hypertension management solution using a kiosk-based approach, exited that, and then founded a bunch of other companies that have had IPOs and do other things. And before HOPPR, most recently, I was part of a company called Hyperfine that did a portable MRI scanner and built the device, got it through FDA, and took the company public on NASDAQ. So yeah, back to square one, starting HOPPR.
Great. You have a fantastic background, and lean in a little bit. I think you're a little muted, so maybe turn up your volume. But what I will say is Khan is someone who's been an active mentor, advisor, angel investor. He's been through a couple very well-known exits in the industry. Any of you that have walked into a retail store might have seen a Higgy piece of hardware, and it's just a trailblazer in the industry, and very excited to have you sort of on the AI front right now. We'll get more into what HOPPR is next. Let's talk to Mike. Mike, give us a little bit of your background. Where did you come from and what are you up to today?
Yeah, certainly, Missy. Thanks for having me. I'm excited to be here. So I am a longtime veteran in the contact center space. So not coming from healthcare traditionally, and have worked at companies like Five9, Verint, Aspect, now Alvaria, largely in product management, product innovation roles, and general management roles. And so most recently was the SVP of product at Five9. Before that, I was the chief product officer and GM for the WFO business at Aspect. And so I've seen the problems people are trying to solve in the contact center space for 2+ decades. And I've also seen that as you get into some of the more complex areas, healthcare being the most extreme of the complex areas, complex verticals you can have, some of the generic solutions, one, don't work very well. And two, some of the approaches we've been trying to leverage to solve problems in the contact center for the last 2 decades are quickly becoming obsolete and quickly being leapfrogged with some of the advancements we've seen in things like real-time transcription, generative AI, the latest innovations in machine learning. And so really so I'm now doing a startup called Tramplain AI, and we are focused on AI-based solutions for healthcare contact centers. And we have the advantage of not having all of the baggage of old approaches and old technology, and can start clean and do this with a generative AI LLM first approach, and start with the right way to do it, the right way based on the current things that we have now, which I think is a massive leapfrog forward for the industry. And part of why I'm doing this is leaving behind the old way so we can start clean and do it right.
And just for our listeners, I mean, contact centers are everywhere in healthcare, but primarily I think we interface a lot with them when we're calling our payer, our health insurance company. We might be litigating a claim. Right. We might need to understand our eligibility. We might have a grievance or appeal. I mean, I was just on the line yesterday trying to, for the 18th time, get a dental claim paid through Cigna. And I'm on my 10th grievance and appeal process for that. And it just seems like every time I call, we have to kind of go through the exact same thing over and over again. So I think many of us understand the pain, and we also understand the pain on the agent side. So really want to dig in there. There are administrative use cases in Gen AI, back office automation, workflow automation, and then there are clinical use cases. Con, you're really on that clinical side, which is pretty bold right now, given where the state of Gen AI is. Tell us a little bit about HOPPR and why you're going deep on clinical.
Yeah, absolutely. I think everything for me ties down to my inner why, right? I like to solve problems that somebody I love is impacted by and create a social impact at the same time. So I'm a radiologist, my wife's a radiologist. And when she comes home nowadays and needs an hour to decompress before she'll talk to me or the kids, that's a problem, right? So, and literally last week I got a text from one of my old colleagues who's at one of the big academic centers, like the worst day I've had. I've never read this many cases in a day. I need another job. And he'd read 142 CT scans that one shift, right? The max I've ever read in clinical practice was 60, right? He was doing twice as much. And can you imagine, as a patient, you don't want to be the last 10 cases he's read, right? And this is a large academic practice, group that, top 10 in the country. And that's the kind of volume they're trying to do. They're currently 3 jobs for every graduating radiology resident. The problem is even humongous internationally. The entire continent of Africa has less pediatric radiologists for 1.2 billion people than just Boston Children's Hospital, right? Like, that's the severity of the problem. In UK, there's a 9-month wait time for MRI scan. In Los Angeles, there's a 6-month wait time to get a breast ultrasound done right now, right? So we are running into this crisis where we're not training more radiologists, but the volume of imaging is going up and up and up. And there's humongous need for automation and equalizing the quality of care in image interpretation across the board. So HOPPR is on using this approach to disrupt how people are thinking about, right? Traditionally, the way we've gone approach these AI models is you build a disease-specific model, get it through FDA approval, and then finally you're out and selling one model. And then you start the next one, then you start the next one. There are millions of diseases and millions of things. Like, how are you going to get to the end of it? And think now from a buyer point of view, to just read a chest x-ray, how many models do I have to buy? When my reimbursement is $17, I have to buy a model for pneumothorax, for pneumonia, for cardiomegaly, for all sorts of fractures and everything that needs to happen. Like, that doesn't make sense, right? So you have to think about and take a different approach. How do you build a generalized model that is much broader aspect of it, and that's not creating new workflow? As radiologists, we love looking at images. We hate doing anything else other than looking at images, right? So how do we automate that entire workflow process? So the way HOPPR is approached is an API model as a service, which is available through an API, and delivery through the existing workflow solutions. So we partner mostly with PACS vendors and other application developers that use our model in conjunction with their functionality to deliver it to the clinical workflow. So instead of creating a new application that people have to now go buy, the existing tools and enable them to be AI enabled. So that's the approach we've taken and the problem we're trying to solve.
Oh, I have so many questions. I want to loop back to that and how that works in real life. Mike, what are the problems just today in call center workflow that you're trying to tackle? Like, sort of how Con laid out, like what radiologists are up against with, we've got labor shortages, we've got increased utilization because everybody's coming out of COVID and getting their services. And there's just more and more pressure for the high volume of reads to be done. What are some of the 3 or 4 top issues that we're seeing at the call center space, particularly in healthcare? And why is it important?
So, yeah, no, well, you alluded to it to begin with, right? As a consumer, as a member of a health plan, calling your health plan is painful, right? You're likely going to have to wait a long time to talk to somebody. You're going to spend a very long time explaining what you're doing. You may get transferred to somebody else who may or may not be able to help you. And the likelihood that you get the problem solved in the first time is not super high. And so you're going to end up calling again. But you flip that around and look at what the contact centers are going through, what the agents are going through. Being an agent in a healthcare contact center is extremely difficult. It's a really hard job. Not only are they measured up and down for every second of what they're doing during the day, but they're being asked to answer questions where they may need to reference dozens or hundreds of documents. Those documents may be 10 or hundreds of pages long to interpret plans that are very complex. They may have 10 or 20 or sometimes 30 different systems that they need to reference to be able to find the answers. And that's simply just to answer a question for you. And now they're being asked to do even more, right? Now, don't just answer questions. We need to be your health concierge. We need to go to that next level. We need to look at the kind of care that you're getting, right? Have you had your annual wellness visit and you haven't? You don't even have a PCP. What's going on? Why don't you have a primary care physician? And how can I help you do that? Or you've got chronic diseases and there's programs that are available. Let me talk to you about those things that are really going to move the needle for your health. But if I can't answer your question, we can't have those other conversations. And on top of that, you have huge seasonal swings in volume, right? You get through open enrollment period, people get their new cards, and so the amount of calls and the type of calls swing dramatically. And it's not surprising that with a job that's that hard, where they don't have much success, where it's very difficult to do the minimum, nonetheless go above and beyond, we see really high turnover in the contact centers as well. So now you're dealing with very long training times and high turnover as well. So ultimately, what we're after is, I think it can be done much better. And I think with the assistance of the latest in real-time transcription, generative AI, that we can get to a place where you can have your question, every question can be answered correctly the first time you call and ask. And then we can spend the time not putting customers on hold, putting them on mute, doing research, but actually engaging with the members, talking to them, building relationships, building rapport, that then opens up the opportunity to have the conversations that will really have a positive health benefit for them. And for the payers, save them a significant amount of money, because now they're talking to their members about the things that really move the needle on preventative care and being proactive with them about their health. And so that's, I think, sort of our big picture, our big mission, and where I think the opportunity is.
I mean, there's so much in sort of helping with search in a knowledge base, summarization. You know, there's so much around just even call summarization after the agent gets off the phone, and problem solving. And I mean, there's an immense amount of lift that I think Gen AI can be doing on the call center side. Let's sort of switch gears a little bit. There's a lot going on in the industry right now. There's a lot of news. I mean, I'm sure you guys saw the Apple Intelligence news. You know, everybody's sort of following every day. There's a new funding announced. You know, either Mistral or there's some massive amount of money being deployed to these big foundational model owners. You know, Khan, I think you have a pretty interesting point of view on this, because there's not a lot of multimodal large, either open source or foundation models. Like, you know, it's not like you're going to use ChatGPT for this kind of deep clinical. So let's talk about, as a startup founder and as someone who wants to offer a solution, what is your approach? I think both of you guys have different approaches, and they represent sort of where the market is today on startup leaders that are moving into these solutioning. So Khan, tell me a little bit about what's your take on, you know, who's out there, you know, what they have to offer. And then we'll get into large language models versus small language models.
We are probably in a very interesting time, at least in my life, on how fast things are moving. And it really helps you think through, how do you prepare for it, and what solution are you building? Are you solution that you're building is designed for capabilities of LLMs today? Or are you really thinking these going to quadruple in the next 3 years, 5 years? And that's how you're thinking from that point of view. The approach we took was really started a long time ago. I remember my first multimodal paper on combining imaging and text was published like in 2011 when I was at Microsoft, right? Some of the early work we did, even like the Connect camera was multimodal, infrared and visible light, right? RGB cameras. So we were training models with temporal, with multimodality, image to image plus image to text type of things in 2011, 2012 type of time frame, but using the older architectures. And we knew how painful it was. So I've understood the problem, have been understanding the problem for a long time and trying to figure out when is the right time to bring something to market. The fundamental reason we decided to build our own vision transformer completely from scratch was there's a difference between visible light images and medical images. So number one is the visible light has 8-bit grayscale, right? So there's 256 shades of gray. So even the monitor you're looking at right now, it only has 256 shades of gray, whereas X-ray images can have 12-bit or 16-bit, mammography 16-bit, which is 66,000 shades of gray, right? So when you are training a model that's trained on natural images, you downsample images to 8-bit to comply with the model requirements. So you're throwing away 99.9% of the information in an image when you're training the model from that point of view. Plus, these models are not trained um, in the context of medical data, right? They're trained on mostly publicly available data, internet-based data, and whatever that is, right? So they're not really taking advantage of what is available through in a clinical context. There's a lot of difference in that aspect of it. The third aspect of it is temporal nature, right? So nobody really cares which cat becomes what over time or which fire hydrant changes in 3 years, but we do care which nodule becomes cancer and what type of cancer and after what treatment which one goes away. So there's a temporal aspect of it that we need to understand. And the multimodality here is complex, right? So it's not just image to text, but it's X-ray to CT, X-ray to CT to ultrasound, and then to MR. And MR has n dimensions, right? It could be all sort of different sequences you can do on that. So it's a very complex n-dimensional multimodality problem that we are trying to solve. So it required a different approach to build our own vision transformer to do it. We are taking advantage of the language side of things, taking advantage of some of the open source stuff out there that we are fine tuning for our purposes. But for the vision encoders and decoders, we are doing it all ourselves from scratch.
And is that a data acquisition strategy where you're trying to find partners that you can acquire data from, that and you strip PHI out or whatever you need to strip out, and you're building kind of a ground truth?
Absolutely. One of the important things for us was that we know data provenance, right? So if anybody is going to build an application on our models, they'll have to submit to FDA. So we are building it under a quality management system with all the auditing and every capabilities that FDA would expect as a supplier to a software as a medical device or a component of a software as a medical device. So number one is you need to build that. Number two is you need to show data provenance. So it is important for us to de-identify the data and not just get data from others, so we can guarantee that the test and validation data did not leak into the training data, and provide that provenance and distribution of data from demographics point of view as part of submission of the application to the FDA. So we partner with a bunch of different health systems, radiology practices, where we become the identifier of the data and the custodian of the data. And because we never share data for other purposes, it's only really used for the HOPPR Foundation model training. We are their partner in this journey.
So I have lots of questions around how you brokered some of those data partnerships. But let's actually go to Mike, because Mike, I think you took a very different approach. Coming from being a veteran and coming from working on the incumbent side of call center software and platforming, I think this was about really trying to figure out how to play nice with the incumbents and how to sort of create a modular format where a lot of the customers that have these sort of large investments in the incumbent platform technology, they're not going to rip them out overnight. This is about you coming in and layering over some productive activity that takes advantage of LLMs and Gen AI without having to displace or completely get rid of. Talk to me a little bit about, so what does that mean in your build and in your go-to-market? Like, are you using a foundation model? You don't have to name it if you don't want to, but how did you think through that?
Yeah, so you're absolutely right. So we are not taking the rip and replace. It's complementary solutions that sit on top of the existing infrastructure that they already have, which does lower the barrier to entry and allows us to get in without having a multi-month, multi-year project to go rip and replace anything. And we're able to augment what's already there and add a significant amount of value leveraging the infrastructure that's already there. I think when we look at the generative AI side of things in the LLMs, which we are using. I sort of see LLMs similar to databases when they were formed, right? So databases are an underlying technology. They're not a solution by itself. They enable solutions, right? The whole CRM industry is just an app built on a database, right? It's just a way to interface with the database. That's all it is. But it's a multi hundreds of billions of dollars industry, and I think LLMs will be similar. So it's not the LLM itself that is the thing that is of value. It's what you do with the LLM, what you do with some of that underlying technology, and being able to focus on the specific solutions we're trying to solve, but using things like real-time transcription and LLMs as an unlock, not as the core value, but as a way to unlock the value, as a way to get into the conversations while they're happening, as a way to provide insights and guidance. But it's not, those don't provide the insights and guidance. They unlock the ability for us to drive that, right? To make sure that call center agents in healthcare plans are following the right processes, they're following the right steps, that they're able to get answers at their fingertips, that you're able to draw insights as to what's going on with your members, with your agents, and where you need to invest time and where you can drive process improvements. So it's not, so I don't see the LLMs as the solution themselves. I see them as the core enabler for us to go and create the solution.
Right. So you're building on top of a foundational model. And that could be a commercial model or an open source model, and you're essentially using that and you're going to market, and then you're building a lot of IP and secret sauce on top of it. Con, you're building your own foundation model, and you're sort of, training and fine tuning, and you're doing inference off of it, right? Okay. So you guys have two very different go-to-markets. And I would say, Mike, the majority of startups that are sort of integrating a Gen AI solution are really more in your camp. It's very rare that a young startup is building a foundation model. That's, yeah.
Well, I think so. I don't want to be in the position where I'm competing with OpenAI and Google and Amazon, because what they're building is what I need. It sounds like Khan is building stuff that is not what Khan needs, is not what they're building. So I'm not going to out-invest OpenAI or any of the others. So I'm going to leverage what they're doing. I'm also doing this. You asked about our foundation model. I won't tell you which one we're using, but the key is we are doing things that are agnostic. So we have chosen one to start with, but it's very easy for us to go and switch. So based on the data that we looked at, 6 months ago, and again 3 months ago, and again today, we have our choice. But if GPT-5 is a massive leap forward, or any of the other vendors come out with something that's a massive leap forward that's significantly better fit and more appropriate for what we're trying to do, we can very easily switch over to that. And I think for the type of business I'm building, I think that's really important, because it doesn't make any sense for us to place our bets with only one LLM right now in a market that's moving this fast. And I don't know what the next thing is going to be. And I certainly don't know what's going to look like in 2 years. So I'm not going to tie myself to any one of them, right? We're choosing one that we're leaning into. This is the best one today. But if that's not true in a year.
And each of them sort of have chosen who their cloud infrastructure partners are and who they're teaming up with. And so, it's a kind of an interesting package, because if you're built on one cloud vendor, they're offering an LLM, or they've teamed up with cloud infrastructure, and hopefully the hyperscalers are going to get to a point where they're not, where they're agnostic too, where they can work with their own if they're offering it, as well as with others. But let's talk about then how you actually think about compute and GPU, because if Con, I don't know if I would sort of classify you as building a small language model, because it seems like it's pretty vast, right? But clearly, if you have an API and you're servicing up your API, and you've already got, I don't know if it's token based or what have you, just on being able to actually take advantage of the foundational model. And then there's probably a bunch of workflow on top of it that you're doing API calls. How do you pass that compute cost on to your customer? And I think, Mike, you're in a very different compute cost model, right? So we'll get to you in a second, but how do you rationalize that, Con, and how do you demand forecast? That's a pretty big, pricing journey, right?
Yeah, absolutely. I think the way to think about this is, the value you're bringing in to your customers, right? you never price based on your cost and type of thing. The better ways is how you price your value, right? How you bringing value in. I think good news is like a lot of the um, health systems and actually users understand their volume of imaging they do annually, right? There's some growth. They pretty much understand there's some variability there, but they understand what their minimum they're going to do in a year. So, and we had to be flexible, right? We had to be able to price on a per image kind of a level where they can actually estimate based on how their volume is, how many images they're doing, so they can do some estimation on what their projected costs are going to be for using an API based stuff. And then that's how kind of we've thought about it. That's where majority of folks are going. And then when there's a larger customer coming in that requires something custom, then that happens. In healthcare, that happens. That you have to go figure out how to do it. We just need to make sure that we have enough margin when we are doing this to be able to respond to those kind of deals. So if somebody big comes in that is doing 20% of all imaging in the United States, yes, we will work with them to figure out what the right model is for them, right? So but at the end of the day, we try to match it to token is harder for people to understand, like what token means. So we've translated that to per image kind of a model, and that has really worked for us.
But it's a volume or consumption model essentially. So it's based on how many images are hitting your API for a read, and that could either be directly into a health system or it could be through their channel, through a PACS or RIS vendor that they're already using that you're embedded in and it deals with them, right? Yeah, the consumption model does seem to be. It's interesting because you do see these solutions, and Mike, this might be interesting on your part. Like there are people in these early days that are thinking about consumption or task based. Like in the prior auth world, there's clearly a lot of really interesting prior auth companies that are trying to actually do, Gen AI, PA reads. There's lots of other solutions that are looking at and eligibility and trying to ping something. So you could do it, there's 100,000 PA requests coming in and you get paid $1 to $5 per request, or it could be even at some point we get to PMPM. At some point we might get to shared savings, like how much on an ROI calculator are we saving in time or saving in outcomes. I think that's a world that's probably 10 years from now on pricing, because Gen AI is so new and we're still trying to figure out how to roll in compute. But Mike, what is your sort of early thinking on this? Because clearly you're paying for best of breed LLM foundation model, and that then gets sort of mirrored back to whatever your customer use is, just for that, like sort of, as you would put it, it's like a database or a CRM, right? How do you factor in that kind of pricing? Yeah. How do you think about it?
So I think there is some different thinking in the industry, and where people have started is looking at sort of a cost plus, because they don't really understand what's going on, and they do weird things that don't make any sense for the contact center, don't make any sense for a business buyer, right? So they look at like, well, how many seconds of transcription do you have? Because I pay for that. And how many LLM calls do you have in number of tokens? Because I pay some fraction of the penny for that. And you go like, and I get 6 different things, and I've got to do an integration, and I pay for that. And you get all these breakdown, and there are vendors out there doing this right now, and the pricing is so convoluted. I've got large numbers multiplied by small numbers, and somewhere out there I should get the price. I'm much more aligned towards what is the value we're delivering, and let me handle all the math and margins for my business in the background. And so let's drive to if we're doing things that assist the agent, let me charge you per agent, right? It's a tool for them that's going to help them be more efficient and effective. I will charge you based on that. I've got all kinds of complexity in terms of my COGS underneath, but it doesn't mean anything to the end customers and to the call centers and to the businesses that they're driving this. Similarly, for those that are doing more automation-oriented things, they're doing chatbots, they're doing IVAs that are solving problems automatically. Well, let me charge you either by call or by sort of like concurrency, right? How many of these can I handle concurrently? And think about sort of a virtual agent, right? So it's virtually somebody that's handling this, right? And how many virtual conversations can I happen? And do that versus, again, all of the complexity that goes in underneath with all the components. And I think when we orient that way, it's a much easier conversation, and it makes it much more clear in terms of what people are buying. And actually for my anchor customers, the first few customers that I'm signing up, I'm offering them a gain share approach to where which I think will actually end up being more expensive, but it de-risks it. Because I think we'll see ones where if we can cut out 30, 40, 50% of the work that an agent is doing on an interaction, because they're not spending time figuring out who's calling, what plan they're on, where what document to look at, what to answer, writing up all the notes at the end. We're streamlining that, getting away from all the busy work and allowing a more seamless conversation. We're not just making them rush, we're making it easier to get to the answer quicker. And if we cut out 30 to 50% of the overall workload, and that means we can reduce costs in a significant way or scale the business in a significant way without adding costs. And so if we took a share of that gain, that's significant. And I think it will ultimately be more expensive, but de-risks it. So we'll probably move back to a more traditional per agent pricing once we've proven out the results and we've taken the first few anchor customers that want to de-risk working with an early stage company. But the value is there, and the closer that I can tie pricing to the value being delivered, I think the more it makes sense for us and for our customers.
Medical imaging is slightly different, but there is precedence on consumption-based pricing there, because every medical imaging health system would have some kind of long-term archive or vendor-neutral archive, which is per gigabyte pricing, right, or per megabyte pricing type of thing. So they used to, they've almost a couple of decades of buying consumption-based long-term archive solutions. So there's understanding that there is some per image cost because it's tied to how much image file sizes and things like that, right? So, and our compute costs are directly tied to the size of the image, right? That's how it happens. So it's this slightly advantage we have because of the precedents that exist, and customers are used to that kind of pricing models. Where I understand Mike's, it's much more challenging to think about that.
Well, and I think the gain sharing is where directionally many like this new layer of automation and using AI to perform tasks to shorten time to essentially like I think you're being measured on your what CCAS scores. I mean, there's all kinds of sort of really interesting gain sharing metrics that I think if you can prove that, that's a really bold and audacious way to sort of like create value from the start. I guess just turning the topic to sort of accuracy and, like Mike, you have a little bit more customer data that you need to ingest because, they're sort of using the foundational model for just general extraction, summarization, and other tasks. And then there's like a bunch of plan data, knowledge databases that you probably have to sort of play with. And then Khan, on your side, you're dealing with canonical diagnostic guidelines in the industry per read, per disease, per what have you. But you're really in a place where sort of model drift, anything around accuracy, all of your benchmarking, that's a big world. So how are you accounting for that?
Yeah, so things that you need to look at all the factors. Once you realize that all these are float point calculations, right? Which means every time there'll be a different number coming back. So you have to start controlling for how can you control, and because that drives, right? So that creates completely different response. If you're looking at the embedding space, mathematics that is happening is generating for the same calculation, generating a different number every single time. So you control from making sure you're on the same spine in the hardware side of things, on the infrastructure side of things. So you're not changing GPUs and hardware because that'll add to the float point integer. You need to make sure your model is frozen in time and is doing continuous validation to make sure there's no model drift happening in that aspect of it. You need to make sure you have discriminative layers built into it as part of a solution. So if the solution is to measure something, you can't have a surgeon saying measure this nodule and a radiologist saying it and a resident saying it and get three different measurements. That's not going to work, right? So you have to build the discriminative layers on top of it that make sure the results are accurate and are validated and are reproducible all the time. So as Mike said, right, LLMs and Gen AI is a tool. And in part of the solution, what the output's supposed to be, you need to combine it with what other things are to make sure you're delivering the right answer at the right time. So if it's, generate text so that a patient understands the report what I'm doing or what's in the image, that can have a lot more flexibility. But generic measurement of this liver lesion, and because I'm going to decide if patient needs to be taken to surgery or chemotherapy or something else, you can't have variability in those measurements, and you have to build all those controls around it. That's why, starting with a quality management system and building all those infrastructure and processes and validation and all of these activities that we do to ensure that we are doing end-to-end control of that model, all the way from which hardware is it running on in a cloud provider. I mean, just imagine negotiating an AWS deal where you're asking, you need to be on the same spine and you can't change me, and I need, the cost of that is very different than just doing on-demand GPUs. You're coming from this, so you understand that piece of it, to controlling end-to-end application delivery side of things, right? So we deal with this on a day-to-day basis. I mean, the good news is, had to deal with when I was at Microsoft, had to deal with in the Hyperfine, where all these were AI-based solutions. So a lot of experience on how to do this stuff. So knock on wood, so far so good.
And Mike, how are you thinking about updating your solutions? Because I don't know if you're sort of doing a seasonal ingest on plan data or guidelines or rules, training data. Like how do you think about the accuracy of being able to actually guide the agents through whatever it is that you're doing on your use case? If it's call summarization, real-time transcripting, problem solving, because the world is changing, right? Like plans change. Usually it's seasonal, it's year over year. How do you deal with the client that way?
Yeah, so I think there's a handful of things that go into it. So first, when we look at, simply how do we get the answer, it is using, current LLM techniques, using things like RAG, right, retrieval augmented generation, to where we need to know who's calling, who the member is, what plan do they have, and therefore which documents are relevant, document or documents are relevant in order to get the answer. Only look there. Only give answers that come from those documents. If they're not in the documents, don't give the answer. Don't give the response. Don't make stuff up, right? And you can get away from some of the hallucinations. And there's ways that we can guardrail around that. But we're also taking the approach of having a human in the loop. So where we're starting is with an agent assistive product. And so there are ways for them to give feedback. Was this the right answer? Is this a good recommendation? Was this the appropriate response? Yes or no? If we write the summary for them, it's editable, right? They can go in and they can edit it, they can change it. And then we can take their feedback, their input, their changes, and learn from that and get better. And so there is some element of, it's not a magic box underneath the covers. You're involved in the process as an agent and as a user. And I think it also, we're taking an approach of doing this in a pragmatic and responsible way, so that we will get to where we'll put the answers directly in front of members and in front of patients. But we're going to get really good at this for a given customer before we do that, right? Because you hear the stories that are horror stories of things going wrong, where they just stuck an LLM bot in front of that, and you get Air Canada making up refund policies for their bereavement policy that didn't exist, or people tricking the LLM to selling them a car for $1. Right? You get these things that aren't guardrailed, and that or I was watching Colbert the other night, and he's talking about the new generative summaries that Google's putting on the searches, and it came back with things like how to get your cheese to stick on your pizza, and one of the part of their summary was to use glue, right? And so you get some really wonky things, and even the best of the best, and even really bright technology companies are getting some screwy things out there. And so if we're keeping a human in the loop and getting really good for a given environment, for given questions, for given plans, and know where we've got really good answers, where we're comfortable directly exposing that to members, and where we want them talking to live agents, then we're going to have a much more, just a much better experience, and a less likelihood of any of these really horror, screwball horrific stories that you hear about. We're going to minimize the chances of that happening by doing this in a more responsible way. So that's the approach that we're taking, right? It's about, how do I drive business value, not how do I have some magic LLM thing that solves all your problems.
I want to break that down. If someone wants to just put forth a definition of RAG just because it's an industry term, and this is we're trying to break down, sort of demystify Gen AI. I don't know, Con, if you want to take a stab, or Mike, or anybody.
Yeah, I think
what that stands for, what it means, what it's been used for a long time. It stands for retrieval augmented generation, I believe. Is that right?
Correct. I think it's about
yeah.
I mean, you're absolutely correct. Retrieval augmented generation is what RAG stands for, and it's all about providing more context, right? Context to and containing the response to certain information that has already been retrieved for a particular task, right? So if you're trying to ask a question about a particular thing, like for example, I wanted to understand in our context, what are the possible outcomes I need to recommend as a follow-up action for this radiology CT scan I'm looking at, providing previous reports as well as summaries from clinical notes as a guideline, like so that you're not recommending something that the clinician or the surgeon has already not talked about. So how do you include that in the context of your response aspect of it? So I think, again, it just depends on what the outcome is, what the solution is, what you're trying to do. The RAG is a tool as part of the different tools to implement. Our foundation model itself is independent of the RAG, how some application provider will implement it. If they want to implement it in which somebody wants to know, as part of this imaging study, what do I need to pull from EHR to show in context before person has dictated a report. So I'm really also not doing a fishing expedition into Epic looking for all sort of different things. And that could be a way to do this stuff in which you define what are the things you need to retrieve to then create a summary out of. So you're not retrieving some psychiatry history and providing depression and bipolar responses to a liver cancer, which may not make sense, or something maybe sensitive that's not to be shown to the clinician. So that, I think that's where the application comes into place. But Mike, you can add more to it.
Yeah, no, I think you got a really good definition there. Just to add a little context to that, if you think about going into ChatGPT and asking, what's my copay for a colonoscopy? What's it going to do? What's it going to come back with? Right? It doesn't know, so it's going to make something up. It's going to make something up semi-intelligently, because probably somewhere in its data set had some sort of health plan information. Is it going to be yours? No. Is it going to be for this year? Probably not. And so when we want to answer a question like that, we need to then insert, all right, here's a 300-page document. The answer's in there. It's for your plan. Go only look in there and tell me what the answer is. Or there's 10 documents. It's in one of those. We think. Go look in all of those and only give me an answer if you find information in there. And if you didn't find information in there, tell me that. Don't tell me, I don't know, it's $150. Well, where'd you get that from? It's somewhere in the training data, and it makes it up, right? So it's really trying to tell it, right? The answer's in here, or the answer. In order to get the answer, you need to layer in these pieces of information and contain your response to that. And I think that containment is really important because LLMs, right, they're next word generators, right? I'm going to generate the next most likely word based on what I've seen in lots of text out there, based on the training data. The training data, it trained a year ago, 2 years ago, and whatever data is in there is the most likely thing. What it is really good at is summarizing known information. And that's a lot of where we can get good answers, is tell it to summarize something from known sources and not to tell me the answer based on what you think you know.
And isn't there a little bit of magic in picking which foundational model? Because some are better at complex decision making and logic. Some might be better because they're more loaded with multimodal. Not in your case, Con, because you're dealing with medical images as opposed to just videos and pictures. And some might be just really good at extraction. Others are really good at summarization. So isn't there sort of a little bit of an art to, hey, this particular model, whether it's small or large, is task-based, is aligned for this particular task. And, I'm either fine-tuning on it, right, with my own data or someone else's data. Seems to me like there'll be a world going forward where we'll start having much more defined models for the task at hand, right? I'm speaking very much in generalities here, but unless you guys have another opinion or feel that I'm off, jump in?
I think so. So yes, there are going to be different models that are better for different things and better in different environments. To make a plug for one of my former companies at Five9, they released something in the last couple months where it's basically your generative AI little studio. And so you can, if there's a Gen AI task you want to do, whether it's summarizing or something else, you can try here. What's the output if I do it through GPT 3.5? What if it's through 4? What if it's through 4.0? What if it's through Llama? What if it's through this?
Yeah.
Right? And you
Where
can
you can
plug it
just
in,
plug the model, yeah.
right? Uh, and, and you can plug and play and do all those really interesting things. So I think for people that are really into the tech and really want to play with that, it's a really convenient way to go and try different models. I think for the approach that we're taking with Trampoline is to go and figure that out on your behalf and to figure out for these types of problems that we're trying to solve. Let's go do this. And so I've got my engineering and data science team that's staying on top of those innovations, staying on top of what's going on in those models, and we'll go figure that out. And if there is like I said, if there's a big breakthrough, we're going to move and not force you to do that. So I think we're going to see just different perturbations of and different interests for people. I think there are some people that really want to know how it works, and they would love the idea of trying 12 different models and running the same transcribed call through that and see what spits out the other end, and trying different prompts and tweaking that, playing with that. There's others that want it to work, and they want to drive the business value and give me the answer and make it work, and I don't care what's under the covers. And I think we're going to find people on that whole spectrum, and so kind of aligning to the people that you're servicing and the approach that they want, and how open do you want it, right? Because I think there's also advantage to having some visibility and not having this mystical black box, because I think that's scary too, right? So we need to have some idea.
A lot that's coming out from the White House. There's certain state-based policies that are like, we need to unpack like what the training data is. There needs to be auditability, traceability. So, that whole black box situation that a lot of our open source friends are in, a lot of our commercial folks are in, not our open source friends. That could be a problem. I mean, Khan, anything more on, I don't know, there might be someone out there building us a foundation model for pathology, right? At some point, like, you're in a very different situation where it doesn't really exist. There's pieces of it, right? So, you're not really trying to be in a playground where there are 4 or 5 different people that are A/B testing the answer, right?
I think, but on the tech side, we are, right. So what other thing I've seen people do is, let's say there's a good model, but it's very expensive. What people are doing is taking the input-output data from there, and then going and training an open source model, which is much, much cheaper, because they're so close, right? If you look at the benchmarks out there, they're very close, right? So you can actually take data from expensive model, and then in a text scenario, take the input output from that and train a smaller model that is open source or cheaper and things like that, and get the same level of accuracy. So I've seen people do that kind of things also. And it's exactly just very narrow for a very narrow task. Absolutely right. I think the biggest issue becomes is, especially in our scenario where our compute cost is so high, right? I mean, it's not the 200 million OpenAI had trained GPT-4, but still pretty significant compared to other startups that are doing this stuff. So how do you maintain it? How do you manage it? And how do you handle continuously changing, right? So December 1st last year, the new Mamba architecture came out, right? Steady state models, which 40 times increased the training capacity and 5 times inference capacity on the same architecture, hardware architecture, right? So is it really better or not? There's still mixed reviews on that. Then the low bit depth models have come out that have reduced the quadratic function from a 16-bit to 1-bit calculation. That reduces your compute time side of things. So for us, because compute is so heavy, being in images, so we pay attention to all these improvements in models that are coming in, and how do you build an architecture where you can switch a transformer-based architecture to a steady-state model to a low-bit depth model that are very different architecturally compared to a transformer-based architecture. So we have to think through in a very different level of not just replacing a open AI model versus Minstrel model versus Meta model. You're talking about completely switching the whole architecture from a very different, no longer T based, but something else based architecture.
Yeah, that's a much more hefty problem to solve. Listen, we're ending our time here. I literally feel like we could actually talk. Just sort of closing us out with like a fun note. What in the next 5 years do you guys predict in your different spaces? If we keep going at the rate that we're going, what do you think you're going to see in call center? What do you think you're going to see in radiology? Mike, we'll close with you, and then we'll go to Con.
Yeah, so I think I'd love to see things like the hold button and the mute button go away, because now we've got the ability to answer these questions, right? I'd love to see.
Is it a human, or is it an AI personality that's handling me now?
I think it's going to be a hybrid of both, and I think it'll be a hybrid of both going forward, because I think there are things where if you've got a new medical diagnosis, you've got questions, and you need answers, but you also need human empathy. And I don't think we're ever going to get to the point where generative AI is able to give you the sympathetic and empathetic ear that you need when you're going through something really difficult in your life. And in healthcare especially, that's going to be part of this. But I think we'll be really good at knowing which things should be automated and which things should go to a human, and which human should they go to. And how do we make that a really painless process to get the right answer and to get the overall care that you need without a huge amount of pain, multiple calls, lots of time on hold and mute. And we'll be able to do this in a far more efficient way, and we'll be able to route things between bots and people in really intelligent
I think there's
way.
a day where we have sort of an agenic framework where you've got two bots doing complex things with each other. I think that would be killer. We're like heading into Skynet there, but I want Scarlett Johansson's voice when I call up, and I want her to be super empathetic. So that's what I'm hoping for in 5 years for any of my centers.
That scares me. I'm going to have my own bot call my healthcare bot, and the bot's going to be talking to each other. I don't know. I can see that happening.
Eric Topol just published a paper that patients found AI response to be more empathetic than the physician responses. You should look that up. So it may be much closer than you think it is. So I've always been bad, overestimated what we can do in 2 years and completely underestimated what we can do in 5 years, right? So let me give you context. All the products out in the market today were trained on A100 GPUs mostly, and were trained on the GPT-based, transformer-based architecture. Now we are slowly seeing the H100-based models coming out. The Blackwell that is coming out next year is not even out yet. Blackwell is supposed to be 40 times more compute efficient and energy efficient than the A100s when the current products are out. And these steady state models and low bit models also going to be 40 times better for training. I can't even imagine 40 times 40 improvement in performance of products next year. I in my brain, I can't even compute what that even means from a feature and capability point of view. What are we talking about? Are we talking about generating a whole movie in a prompt that I want to see a next version of Spider-Man movie of 1.5 hours with these characters and these things happen, and it's going to be a full Marvel level quality coming out of it? Is that what we're talking about when you see examples of Sora and those clips coming out? But with that much compute, is that what's going to happen? I don't know, but it's really hard to predict what that kind of. This is breaking Moore's law like gangbusters, right? We haven't seen this kind of acceleration in technology ever before. So there is no precedence for me to even enable myself to guess what's going to be available next. I'm talking about next year. These things are coming out September of this year, right? The Blackwell GPU. So by next year, this time, we will have models coming out trained on these things. Forget 5 years from now. Like, I have no idea. I can't even predict what these things are going to do next year.
We are certainly in a technology shift. This is a moment in time, and this is why we have such great leaders like you guys jumping in to try to sort of catapult us forward and riding the wave. And just so appreciative of your time today. Thank you so much for joining. and being on the monthly series, explaining some hard concepts like RAG and this and that to our listeners, and giving them some use cases and some ideas of how startup leaders can actually enter in the space. Appreciate both of you guys being here and look forward to your future success. Thank you.
Great to see you, Mike.